am Dr. Pramod VK, Senior Interventional Cardiologist from Ashwini Hospital, Thrissur. Today, I am going to give you a latest update in hypertension. As per WHO, nearly 63% of total deaths in India are due to non-communicable diseases, of which 27% are attributed to coronary vascular disease, which affects 45% people in the 40 to 69 age group. Raised blood pressure is the most important risk factor for coronary vascular disease. Moreover, it remains poorly controlled due to low awareness about hypertension, lack of appropriate care through primary care, and poor follow-up of the patients. In India, the prevalence has also gone over 30 years to 38% in men and 32% in women from the 29%, according to the WHO calculation. Despite that, nearly half of the people, or 51% of the men and 41% of the women, are give proper blood pressure control, and they were also unaware of the BP disease. Additionally, over 62% of the men and more than 53% of the women living with hypertension did not get treatment. Medication was used to control BP in fewer than 1 in 5 men and 1 in 4 women with hypertension worldwide, according to the latest Lancet 2021 report. So, International Society of Hypertension has released the ISH 2020 Global Hypertension Practice Guidelines. The inclusion of optimal and essential treatment paradigm attempt to address the issue that in resource to poor settings. Optimal care refers to the evidence-based standard treatment of the blood pressure and the proper control of the BP according to the standard prescribed. The AHA-ACC has released a scientific statement in 2021 offering new guidelines for the management of stage 1 hypertension among patients with low atherosclerotic risk. Among low-risk adults with CVD risk of 10-year risk less than 10%, with stage 1 hypertension, initially we can include the diet control and non-pharmacological management with exercise. Even if after the diet control and non-pharmacological measures, if the BP remain uncontrolled after 3 to 6 months, we should start the pharmacological treatment with drugs. The lowering the systolic blood pressure to the target of 110 to 130 millimeters range substantially reduce the cardiovascular adverse events according to the various trials. So, among some 8,500 patients aged 60 to 80 in China, the intensive BP lowering targeted and reduced the 26% of composite cardiovascular risk. This was also found in a US study among the professional societies. So, some of the BP measurements in the office, some patients will have high office BP recording when we see the BP patients in our clinics. But the patients will have normal BP at their home. So, these patients can be detected using ambulatory BP monitoring. So, ambulatory BP monitoring is a very device to look for the any out-of-office measurements. And according to the 2018 European Guidelines on the Management of Arterial Hypertension, the nighttime blood pressure recording from the ABPM gives a good cardiovascular risk assessment. So this may be considered as the most relevant measurement for the estimating the cardiovascular risk. So for every 20 to 10 millimeters increment of BP measured at the night, the risk of mortality increased by 23%. And the risk of cardiovascular events by 36%. And most patients with hypertension require lifelong medical therapy to achieve the optimal BP control. So 2018 European guidelines equally recommend the 5 classes of antihypertensive drugs. So considering high non-adherence treatment, the importance of combination treatment is particularly highlighted to improve patient adherence to the treatment and drug compliance. So therefore, the 2018 European guidelines recommend to start antihypertensive therapy with an initial dual fixed dose combination of ACE1 inhibitors or ARB plus calcium channel blockers or diuretics in stage 2 hypertension. The HYGEA study represents the largest study that tested nighttime antihypertensive. In this trial, chronotherapy was associated with a significant reduction in endpoints, including death. The HYGEA chronotherapy trial tested whether nighttime therapy in comparison to usual awakening hypertension therapy exerts a favorable cardiovascular risk reduction. The largest study included a total of 19,084 hypertensive patients during an average follow-up of 6.3 years. 1,152 participants experienced the primary cardiovascular outcome. An ambulatory BP measurement was performed for 48 hours to collect data on how BP differed during sleep. The relative risk reduction for cardiovascular events was significantly improved for nitrate treatment when compared with awakening treatment. So, if you are using a 24-hour OD dosage, it's better to give at a night. So, to summarize, the adequate BP control is good for prevention of cardiovascular disease. It also prevents the stroke, myocardial infarction, and death from various causes. So, we should all target the better BP control with proper diet management, exercise, and proper pharmacological therapy using drugs. Thank you.